So first of all, I would like to talk about the definition of heart failure. Heart that cannot keep up with its workload, the body may not get the oxygen that it needs. So what happens in heart failure? So the heart muscles doesn't pump the blood out of the heart as it should. So as a result of that, there are so many symptoms, like because there is backflow of blood from the heart back to the lungs, it causes symptoms such as shortness of breath, right? We'll talk about the signs and symptoms later on in the slide. So let's talk about the risk factors of heart failure first. So first one is aging. So what happens with the age? So in older adults, it is very common to have congestive heart failure. So there are degenerative changes in the heart, like the function of the heart and also the structure of the heart. So it is one of the risk factors for heart failure. Anybody who has a family history of heart failure, they are at risk as well. Next one is unhealthy lifestyle, lung diseases, and it is very common in African Americans as well. So there are some causes that I have written here. The number one cause of heart failure is coronary heart disease, heart inflammation, hypertension, cardiomyopathy, valvular heart disease, some medications such as cytotoxic, beta blockers, and antiarrhythmetics. And the last one is alcohol abuse and the use of recreational drugs. So next we will talk about the types of heart failure. So before we go to the types of heart failure, I would like to talk about the anatomy of the heart, or the blood circulation of the heart, because it is very important for you guys to know how the blood flows in the heart to understand the signs and symptoms of the heart failure and the types of heart failure. So as you see in the diagram here, so the purple is the deoxygenated blood and the pink is the oxygenated blood. So as you see, the superior vena cava, inferior vena cava, these are the ones that carry deoxygenated blood from the body to the heart. So where does it take the blood? It takes through the right atrium, and through these valves from the right atrium, the deoxygenated blood goes to the right ventricle. So from the right ventricle, what's going to happen next? So it's deoxygenated blood. There's supposed to be some gas exchange. So where the blood is going? So blood from right ventricle, it's going to the lungs. So what's taking the blood to the lungs? That is pulmonary arteries. So pulmonary arteries, the only arteries in the body that carries deoxygenated blood in the body. So it takes to the lungs. In the lungs, there's the gas exchange. From the lungs, the deoxygenated blood converts into the oxygenated blood. So the oxygenated blood comes back to the heart via pulmonary veins, as you see it right here. So it comes through the left atrium. From the left atrium through the valves, it goes to the left ventricle. So see, it was deoxygenated blood on the right side of the heart, and there's oxygenated blood on the left side of the heart. So